That's all done. Yeah, perfect.
Brilliant. Fantastic. So hi everyone. Firstly, my name's Ellie. I'm one of the college tutors for St Peter's and TPD for Surrey. I'm hoping that this is going to help to demystify ARCPs, because a lot of people get very stressed and worried about them. And I think it helps if I can try and just explain a little bit about the process. And I've got a very quick presentation, which I thought I'd start off with, which I actually give to all the college tutors and educational supervisors when I do, we do a sort of training session on ARCPs. And I'll flip through it. It's written in for supervisors, but I think it will give you a really good idea of what actually happens at ARCP. Then we'll run through the questions that have come through and obviously any additional questions that you have. I will just say I'm very sorry I didn't get to come to the conference last week. I've been fighting a horrible cough, which is still here. I'm absolutely convinced I've got pertussis, but if I do suddenly start coughing, don't panic. I'll have a quick drink and it will all be fine. So if I start by just bringing up this PowerPoint and hoping that you guys can all see it. Is that working at the moment? Can you all see my slide?
Yes, we can.
Brilliant. Okay, so let me just very quickly run through what an ARCP is. You lovely people, and we're now meant to refer to you as PG DITs or postgraduate doctors in training. You need to lead on it, but we ask all of our consultant colleagues who are your educational supervisors, you may need a little bit of prompt and guidance. We tend to run them twice a year, okay, in summer and winter. And so usually the winter ones are sort of around February time. The summer ones for this year are June 19, 20 and 21. So it's a Wednesday, Thursday, Friday, the 19th, 20th and 21st. We will not be looking at any portfolios until those dates. So usually you get an email through that says you must have everything in by the end of May. And yes, we try and get you to be organised, but we won't actually physically be checking until the 19th, 20th and 21st. Please don't let that mean that you wait until the 18th before you do a mad flurry. But just to give you a little bit of heads up, that is when we'll be running the ARCP dates. And although we're running them in June, we are signing you off for the whole of that 6 months, theoretically, which is always a little bit weird to get your head around. You need to have an ARCP every year. What the Gold Guide says is maximum of 15 months in between. But if you can get into the habit of thinking, even if you are less than full time and haven't done it, you're not completing a full training year, aim to get an ARCP every year, because what that is doing is signing that you're on progress. We may say, and when I say progress, you're on track. Sorry, the word progress obviously is quite difficult when that's what your curriculum's called as well. So the idea is we sign you off every year, and we sometimes will timetable in an extra review. So say you're someone who is working less than full time, we see you in the summer, you're doing really well, but we know we're going to sign you off that training year in another 6 months. We'll timetable you in to have a follow-up or an interim review to do so. So it's really good if you can get into the habit of, even if you're out of programme, you need to get an ARCP every year. And we try and keep a track of things, but we've had a bit of an interesting time, and we're definitely finding some trainees that haven't had one every year as ideally. And that's why we're trying to empower you, we're trying to empower the educational supervisors and everyone to understand. Usually you should have an email. We've sent it all out to all the college tutors because we thought that was the best way to notify you, but our HEC team will be sending you out an email just to flag up exactly what's needed, and I will make sure that in it is a sort of up-to-date checklist. Please get into the habit of having an up-to-date CV, at least annually. It's really, really good. And I think we should actually be encouraging or mandating it. It's what we really look for when we're looking for allocations. It helps for you as well going forward. And a really important form that you'll hear lots of people talk about is the Form R, which you can access through the portal. And basically, that gives us a bit of an idea of your posts, whether you're less than full time or not. Have you had any days out of training? Any involvements and any incidents or things, and it's something that we have to see to be able to sign you off. And I would recommend you have an ARCP folder in Kaizen for each year, and it can be either dated 2023, 2024, you can date it according to your training year, but it's just so handy if you can put everything into that folder. Because the way that ARCPs actually run is that they're run in absentia. So you will have a panel of consultants, educational supervisors, TPDs, college tutors, and they may not know you. You will be a name, and they will be searching through your e-portfolio to try and tick off the boxes to make us feel that we've seen enough to sign you off for your annual review. And there will be times when we know you really well, but you have to rely on the fact that it might be someone who doesn't know you. So what's really important is that you have an educational supervisor's report for ARCP for every post you have done. If you are in a 12-month post in the same hospital doing the same job, you just need one. But if you say are at St Peter's and you are doing 6 months of neonates and then 6 months of general paediatrics, you are going to need 2. And the important thing also to mention is if you are working, say, in community and you have a clinical supervisor in the acute setting or vice versa, you will need to make sure that you have that clinical supervisor's report as well. OK, so you may need to have just one educational supervisor's report for ARCP. You may need to have 2, depending on whether those posts are a 12-month post or 2 separate 6-month posts. And if you're changing specialty, like going from neonates to general, you will need one for each because it's meant to be signing you off that particular job. So it's really important, as I've reiterated to you, that we may not know you, OK? And so we are going to be going through our little checklist, which is going to be, have we got the right reports? Have we got the Form R? Have we engaged with our e-portfolio? All these things. And so the more you can do and the more you can put in one folder, the much speedier it will be. And the likelihood is that we're not going to miss anything. So in terms of the outcomes, we're all going for an outcome 1, which is satisfactory progress. You're achieving competencies and progressing at the expected rate. That might mean that you're then signed off your training year and going on to the next year. It might be that because you're less than full time, you might need to do a little bit extra, but basically you're doing everything that is possibly needed. Outcome 2 is where you need specific competencies to progress, and the classic situation is exam progression. And it might be that actually clinically and everything else, you're doing everything you need, but we just need to acknowledge that we haven't quite ticked all the boxes yet. And so in the past, we used to denote it as an ST3R, for example, and it might be that you won't need any extra training time, but we have to acknowledge that sort of that part of your training that we need to make sure that we keep an eye on. And outcome 3 is where you are making inadequate progress, and there can be various reasons for this, and that additional training time is required. And we sort of say up to 12 months full-time equivalent remedial training. Now, both outcome 2 and outcome 3 should never come as a surprise, OK? And usually you should have been forewarned and you're well aware that this is happening. We rarely would issue these without there have been some previous discussion in order that you understand exactly where we're coming from. So this should never come as a surprise, and it's not about passing or failing, but what it is about is trying to recognise your individual needs, putting the support in place, whether it's additional training time or support through the exams, in order to get you to a place where we can then change, move on and give you an outcome 1. At the next ARCP. And although you may have an outcome 2 or an outcome 3 through your training, it's not something that you should ever feel is hanging over you. OK, there are plenty of fantastic consultants out there who in the past, or newer consultants, might well have had an outcome 2 or outcome 3, but it's just something that at that time you are needing that a bit of additional time. An outcome 4 is very rare, and that is where you've exceeded all your additional training time and you're released from training, and there is an appeal process in place. And again, this should never come as a surprise. The one that we get the most common is an outcome 5, and that is where incomplete evidence has been provided. And what tends to happen is it will be that we haven't got the right educational supervisor's report. There might not be a mandated course certificate such as APLS or EPALS or NLS. It might be that you haven't done enough docs if you're at a particular point of progression. And the idea is that you can easily convert this to an outcome 1, but basically you have 10 days to upload the 10 working days to upload the missing information that's needed. And within reason, sometimes we'll be more flexible with the timing. We then have to meet again as a panel, and it's usually the TPDs and Dr. Wynne as head of school. And so it won't necessarily be at the end of that 10 days because we've got to find time to do it. So it may well be a few weeks later. But the idea is that you will email in or upload all of the relevant information. You will let us know, and we will try to email you ourselves, one of the panel members, so we can then keep an eye on things. And usually we've got your form, a form in draft, and we're all ready to go, but we will then convert your outcome. And outcome 6 is CCT, and an outcome 8 is all your out of programme maternity leave, paternity leave, etc. that you might do. So I think it's really important you view your educational supervisor's report as the way that you can sell your progress. OK, it's not just a tick box exercise. What we ask of the consultants is that they are saying that you are performing at the right level. Are they ready to progress? Are you on track? And that's where you can sell yourself about everything that you've done over the year. And then you want your supervisor to have the time to be able to sell you as well. OK, and it's an overview of your time in that post. And really and truly, what the most important thing that we utilise to be able to feel that we can safely and securely sign off is that educational supervisor's report, because we do not have time to go through every single thing that you've linked and every single work-based place assessment that you've done. We will pick randomly to try and make sure that we've got a good feel. But the more information in that supervisor's report, firstly, that you have done, telling us just what you've got out of the year and all the fabulous things that you've done, but then also that the supervisor is there basically saying, I think they're doing fantastically well. I've got absolutely no concerns. We can be really reassured in how we then go ahead and can sign you off. So we talk about the number of assessments. We look at your feedback. We can think about whether we need another MSF and things. We look at your life support provision, exam progression. We look at your courses. We look at your curriculum and your engagement with Kaizen. There's always a mad flurry just before ARCPs. It's always nice to see that there's sort of regular engagement through the years. And if any concerns have been escalated, it should all have been handled already by you being aware that none of this should come as a surprise. And it may be that the college tutor or the TPD has been around, and we can then think about whether we need to arrange a face-to-face. And it's nothing to be scared of, because when we're doing a face-to-face, what we're trying to do is to put a face to all of our, so you feel in a supported environment, but then we can then work out how we can best support you to get things back on track. The curriculum domains and sign-off is a big headache and was introduced a few years ago. And it's a little bit tricky because it really depends on where you are and what level you are. For those of you who have stayed on the old curriculum, which is the progress curriculum, there'll be level 1, level 2 and level 3 trainees. And I think most people now will be level 3. And so therefore you will have 2 curriculums, which are progress, which is your generic, which is your just the 11 domains that you'll be familiar with. And then your subspecialty curriculum, which you're either a grid trainee in a specialty or you are specialising in general paediatrics. The Progress Plus curriculum is ST1 to ST7. It's the new curriculum. And what you'll see is in each, there will be 11 domains, and we'll have a look at any portfolio in a bit in case you've got any queries. And there'll be a core learning outcome for each domain. And within each domain, there are key capabilities to be linked to. And there's lots and lots of support and help on the college website about examples and illustrations of how you can link to these key capabilities. They need to be signed off as achieved, and the only person who can do this is your educational supervisor. But they can do it at any point in time as your educational supervisor. So you don't have to wait till you get to a certain period before everything gets signed off, but you need to make sure that they are all signed off by the key progression points. And on the old style progress curriculum, that would have been when you were progressing from level 1 to level 2, so ST3 to 4, then ST5 to 6, and then at CCT. Obviously, with Progress Plus, you've just got your core training, which is up to end of ST4, and then you've got your 5, 6, 7. So they've taken out a level in terms of your training, but it's really important that you have those domains as signed off as achieved. And what now is happening with Progress Plus is your exams don't have to be completed until the end of ST4, but there is lots of information about and lots of work-based place assessments around your ST3 year where we're really trying to evidence that you are ready to step up. So if you're already able to step up, but certainly, you know, in terms of where you're working, different hospitals will work on different sort of rotas, but you need to have a sort of evidence that you are ready to sort of progress and be on that middle grade rota. And so the range of assessment keeps on changing, but I think the one for you, if you're looking at to be that stepping up, is that ECAT, which is Entrustment with Care Assessment Tool. And I think it's quite clever to utilise one of these for all the areas that you may work in. So probably at least one from a neonatal perspective, at least one on a general paediatric ward, and probably one from an ED assessment. And that way you're just, someone is assessing you to say, absolutely, you're ready to step up. They did talk about a readiness for tier 2 working form, but that seems to have disappeared at the moment. It will probably reappear again, because the problem is, as I'm sure you notice, Kaizen keeps on changing. And the MSF is really good. They've changed the format a bit, so sometimes you may be asked by your supervisor to about a targeted MSF, because the idea is when we're really trying to work through identifying learning needs. And if you as assessors of your peers, please think about positive constructive feedback rather than they're marvellous, they're excellent, there's no need for any development, because everyone has developmental needs. And I think we have to be really careful that the new MSF doesn't do away with actually providing that information. Basically, this is more for the supervisor, so I'm going to move on a little bit and just leave the presentation now, because I'm pretty sure that you will have some questions and I'm very happy to answer them, or we can go through the questions that were sent first of all. But I'll hand over to Kingsley to sort of lead the way.
Yeah, maybe I was thinking maybe if we go through the questions that were sent earlier on, and then maybe as we go through, if people then have more questions, then we can take more questions at the end.
Sounds good. Okay, so I had first timers to know what expected and what the process of ARCP entails. Is there any specific question? I suppose the question I've got is anyone got, now that I've explained sort of how it works, I can tell you that there is, so we're aiming to do them face-to-face, as in the panels face-to-face as much as we can this year. So we're probably going to be, we were going to try and go to London, but it's not going to happen. But I think the idea is we're going to try and get people, the consultants together to do them. And the way it works is there's a random list, and you'll have a TPD that's chairing. Dr. Wynne will be floating between the rooms to be able to answer any specific questions. And basically we will work through them in no specific order through the 3 days. And you may find that you might not get your report straight away, because we may email you going, we're all ready, but we just need this little tiny bit of information. We try and avoid outcome 5s unless there's really too much that we can't sort of catch up. But the way it works is we'll sit round a table or with our computers, and usually it's the TPD that will do the typing, and I would normally say to my colleagues, right, I need someone to look at the educational supervisor's report, I want someone to look at life support and safeguarding, I want someone to look at the MSF, I want someone to look at engagement with ePortfolio, someone to quickly look through the CV, and let's just and then the Form R, and let's just get an overview of where we're at. And then we also have to think about if you're less than full time, or if you've had some time out of programme. We need to be thinking how, you know, where you are in your training and how much more time you need. So any additional information there is always very helpful. And we will set a CCT date based on what we think, but it may be wrong, and that's there's room for sort of discussion if needs be. So does anyone have any other questions, I guess, about that first question before I move on? If you're you should either only have Progress or Progress Plus now. And if you were started on Progress and if you're in your last year of training, you'll stay on Progress, but otherwise they're probably transitioning you onto Progress Plus. So the question was, if since Progress Plus was initiated after we started, do I need to add anything on Progress as well? So I think what we say is we're not going to look back at your previous training years. We're going to expect if you passed your ARCP, you passed your ARCP. Now what we're going to just be looking at is that everything is logged in the curriculum that's on your e-portfolio. And the thing to be a little bit caught out about is that, or not to be caught out about, is that you may have thought you had filled all the domains, but with Progress, from Progress to Progress Plus, they've added a few extra little key learning objectives. So just go back and make sure that you have linked to all of them. Okay. If the assessments were sent but completed by assessors, does it count? So if you say, okay, I think you're asking if the assessments are sent and the assessors haven't completed them. Is that right? Because I think there is engagement, but it won't count as an assessment. So we'll see that you're trying and we'll see that it's there. But I suppose what we would be looking for is that you've chased it up. And what I know that there is sometimes some feedback around, consultants take time and then you don't get your assessments. I think we've talked about it in the STC as well. And certainly I've talked about it in our LFG. I think that it's a two-way street, and it also depends on, often what happens is we'll do something or we'll do a group CBD, and if you can be timely in submitting your request, it will probably get done. But as consultants, we're all running around all over the place, and then it just gets buried in the mound of emails until someone has time to go, right, I'm doing my Kaizen again. So politely, gently prodding, I think no one would mind about. But it's if you wait 3 months and then suddenly you're doing these retrospective ones, that's when it gets a little bit tricky. But I think if you are finding that somebody is not completing the assessments and you are not getting what you need, it's really important that you raise it up, and you can raise it up through your LFG. You can speak to your college tutor. You can certainly speak to one of the TPDs. We understand it is difficult, and we need to try and help that. But I guess it's just, let's all work together, and if you can be timely, then we can try and be timely as well. And I certainly do not mind a nice gentle nudge every now and then. So I think that hopefully will help. There was something before about is the portfolio timeline viewed in order of date created or date occurred? I mean, I think we kind of look at, I don't think we necessarily are that strict. We just look that there's, there is a range. We often will see them that they've had to, they've been submitted again. And believe you me, just if you only have a final flurry and get all the tick boxes, I don't think you're not going to not progress, but we may just make a comment of, contemporaneous logging more than anything else. So I think I don't think we really look, I mean, we'll keep an eye, and we obviously have to keep a little bit of an eye on what level you were and how long you're trying to utilise that particular assessment. But I don't think it's anything from that point of view. If I've had my ES changed after 6 months and a 12-month placement, would it suffice if my current ES signed my... And let me get my head around this. We've changed educational supervisors after 6 months. Current ES signed ES report for ARCP, total of 3, induction report previous ES. I think basically we need to just know that you're making appropriate progress in those posts, okay? And so the more, I don't think if you've started off with one person and then for whatever reason, we understand that supervisors may have to change, and it will probably be out of your hands from that point of view. So long as there is a clear sort of induction plan and you've got a PDP, and that somebody is signing off and saying that they are happy that based on your PDP, based on your time, they are comfortable to sign you off in that post, I don't think it would be a problem. Hopefully that answers that question. So what have we got? I'm ST5. I'm on the level 1, although I completed level 1 at the end of recently. So if you, okay, so somebody is ST5 on the level 1. So if you're ST5, you should really be on level 2 anyway, I would say.
It's because I'm equivalent to core 4, so I'm ST5
Right.
on the old numbering.
Right.
But core
So you
4
did an
on
extra
the new one.
ST4 year.
Essentially, yeah.
Yeah. Okay.
So I will
Right.
do a total of 8 years.
But you've already had your level 2 signed off, haven't you?
Yeah. So
Yeah.
I started level 2 last year, and this would have been my second year of level 2. But because
Yeah.
I'm core 4, I was put back to level 1.
Okay.
So now I've got a weird portfolio that's a mixture of 1 and 2.
So does that mean, so they've now added IO, but did they have IO previously or not?
No, it wasn't a mandatory DOPS, it was optional.
Okay.
I've done it once in the middle of the night, so it wasn't supervised by anybody, so I can't get it
So I
in real life.
I think as you've said, you know, some people don't have that opportunity, and I think that in that particular instance, I would make sure it's documented in your e-portfolio exactly, you know, from that point of view, that you'd already been signed off level 2, but because of everything you've gone back. I think linking APLS and to show, I think that is absolutely fine. And what you can do is actually have a conversation with your supervisor and acknowledge that this is what we've agreed from that point of view, because actually you've already been signed off level 2, or you know, you've already been signed off level 1, and this is where it's going to get very academic. And I think so long as it's really clear, I would hope that we would be able to, you know, move forward from that point of view. We can't suddenly magic up a whole load of IOs for people. So I think linking, so long as you've done APLS, for me, I think that would be acceptable. But if you can just make sure it's signposted, I think that's appropriate.
Okay, yeah, I know that there's 2 of my other colleagues who are ST3 and ST4, so they've never completed level 1 before, who are in the same boat. And we've emailed 3 different consultants to try and arrange a sim session to demonstrate the skill, and we're just getting nowhere with it. So do you think
I think
all 3 of us link it to APLS?
I will talk to my TPD colleagues and Dr. Wynne about that particular aspect, but I think, you know, we discuss it in we cover it in APLS. Obviously, I don't know whether EPALS covers it. And it might just be that that's something that we might have to then, if there's a particular issue, we may have to sort of talk to the college tutor in your hospitals and say that actually you need to do a sim session on it to be able, I think that, you know, and we can try and facilitate that. So leave that with me to have a chat with the TPDs, okay? And
thank you.
if I suppose it would be useful from the trainees committee if you could keep a log of any particular hospitals where, or, you know, if we need to think about this, you know, we can encourage people to like notify their TPD or myself or whatever, just so we can try and keep a log. But I wouldn't let this be a sort of something that keeps you up at night. OK, there's no need for that. We will work out a plan.
Wonderful. Thank you.
Do I need to inform college or add to my e-portfolio if I'm going on maternity leave? Yes, you do need to contact. You go through the portal and announce your pregnancy and your maternity. If you are leaving before you go on maternity leave, depending on where you're at, you might, depending on when you're going on maternity leave, you might still do the summer ARCP. You might still get an outcome 1, and we will just acknowledge that you will be you know, going on maternity, depending on how much time you need. And often with discussion with yourself, it's whether we feel that, say you're going on maternity at the middle of August, and actually it's the end of your ST2 year, and actually the consultants are really happy and think you're ready to progress, and you feel ready to progress, then we might sign you off that year, and when you come back you go into ST3. However, there's a lot of people who, you know, the idea of going back in and going up to another level is daunting. So I think that's a discussion with your supervisor, discussion with your TPD, and we can make a plan. But we do need to know, and it's really important that we have an idea if you are going on maternity leave, when you're going on maternity leave, and roughly when you think you might be back. so that we can make sure you have a post to come into. And if you can give us any inclination as to whether you're coming back full time or not, we can also then make a plan from that point of view. Right, let me just, I've got the wrong mouse. Do all the key capabilities have to be linked before ARCP or before the end of the training year? I think that if your supervisor feels that it's highly likely that you are going to be able to link them if you haven't already, because we appreciate we are doing the ARCP in June, and that you are, you know, you've got a couple of months left, then what we will need to do, because the problem is about signing off that curriculum. And one of the, it will only be an issue with your key progression points. Other than that, if you're, you know, not in a key progression point, it won't be a major problem. So I would anticipate that if you are on, well, either Progress or Progress Plus, you've got time to link to all those key capabilities. So if you're an ST1, I would certainly not expect your key capabilities to all be linked. I would hope that there would be a start of linking to each of those. But if you are coming up to the end of ST4 in Progress Plus, or the end of, you know, you're coming up to sort of ST, you're looking for CCT, of course, we would expect those to be able to be signed off because you've had time to do them. So you, as an ST4 trainee, I think it all depends. And I appreciate if people have started at ST4, that might mean a little bit, it might be a little bit harder to do. And so that might be one that we need to have a discussion and be aware of. And again, it's all about what's contained in that educational supervisor's report. Because if your supervisor's report basically says they're doing brilliantly, they are absolutely fantastic, I have no concerns that by the end of August we will have ticked off all of these, then we will probably, you know, we will probably be very happy from that point of view and acknowledge, and we may just do a follow-up sort of just check in and remind the supervisor that those curriculums have to be signed off, but we will put a little comment to say we acknowledge you've had a limited access to training because you've come in at a later date.
Hello, thank you very much. My name is Chris. I'm the one who raised the question currently ST4. So I started ST4 with community, and I'm now in a neonatal job. And of course, within the last years when Progress Plus came in, a few extra key capabilities came in. Yeah. So it may vary. I think at the moment, for example, there may be a key capability with just one thing. For example, I know we're meant to go with, you know, quality over quantity, but I just wonder how at risk I am of, you know, just saying, oh, Chris hasn't really engaged well because he's been able to get one thing. But it's, you can probably appreciate the difficulty of doing certain things on community as opposed to my current more acute job. So
yeah, no, and I promise you, we're not ogres, and we've been where you are. It might have been a slightly different way we had to do it. So I think it's all about what you put in your report and what your supervisor puts. Okay, because I think we absolutely understand that if you've had, you know, you've had limited time, particularly if you've done a certain specialty like community, that you don't have as much opportunity or access to do these things. So I think it's just about having a look at the whole situation. And if you think that there might be an issue, then what we can do is prep in advance and have a good look at it with either your college tutor or with your TPD, and we can preempt any problems. But I can't imagine that shouldn't be a massive stumbling block, because I think with this change from Progress to Progress Plus as well, I think that, you know, we're going to have to be a little bit flexible, and I think that's what we are keen to do. There are certain things. The reason we're so pedantic is because when you get to the end of your training, someone in the college, when we submit and say this person is ready to CCT, they do actually go back through and make sure everything's been ticked off. It must be a very interesting job for someone. But we have to make sure, therefore, that we have got that. And so it might just be that we have to do a little bit of a check-in and we make sure that we're happy that everything has then been signed off, you know, going forward. So there's lots of ways that we can resurrect that. We might even say, do you know what, you're on track, but what we'll do is we'll save signing your form until such a time, and let's have a look and see what else you need to do. So don't worry would be my suggestion, and I'm happy to talk with separately and have a look at your e-portfolio, and we can see from that point of view.
Thank you very much.
You can complete your Form R really any time. It's just important if you then have a more time out of training that you update it with an up-to-date one, because we do have to log how much time out of training. But, you know, we're already we're the 8th of May and we're going to be doing them in just over a month. So I would, you know, be organised. But if by any chance you then miss out or have less training, then I think we, you know, you may have more time out of training. It would just be an up-to-date one. And you can just, you know, just to make sure that you flag up that you've had additional time out. ST1, I was using Kaizen for my F3 fellow job, which isn't counted towards. Do I need to untag my stuff? Will it give the panel an accurate picture? I think, although it doesn't count towards training, you can still continually tag. So I think what we would look for is that, because we know it will be obvious from your CV that you've done a lot of stuff before. And the likelihood is in the future, you're going to look to probably potentially want to fast track. So I think all I would say is don't untag it. But my suggestion would be is that you continue to tag so that we see that you've got some contemporaneous tagging, and it's not just that everything was done as an F3 and actually you've not done anything, or you're not bothering to engage in this ST1 year. And you know, you can acknowledge that in your educational supervisor's report. But so although we will look to see that there's some up-to-date stuff being tagged, but I wouldn't untag. I really think that would be a complete waste of everyone's time. Hopefully that answers that question. What content structure are you looking for in a CV? I mean, there's no specific, I don't think we certainly at the moment haven't got a desired CV. I think it's nice to have a career aspiration, but that may be something that we can take back and talk to the trainees committee about, because it might be that actually if we have more of a sort of a template for you, but I don't think we have a particular, well, I certainly don't. I get excited when I see a CV, because it just means that someone is thinking things through. But it certainly is more about just getting into the habit of having a CV than anything else. Can be completed from Sims. I think if that was around about the DOPS, I think with certain things, I think we would probably expect. I would say things like cannulas and LPs, no, you would need to be able to do that and demonstrate. And you should have plenty of opportunity. I've entered into training as ST3 this March. Much evidence on Kaizen when I was a clinical fellow. Can I add those evidence for my? I think again, yes, because you've obviously got that experience, and you won't have had an ST1 or ST2 ARCP. But I would want to see probably that, again, as I said in the previous answer, that we have some evidence of you tagging things in your ST3 year. And one of the things I used to recommend to my trainees is that, you know, you may have got when you did your first ever neonatal job, you've probably got some of the DOPS, for example. There's nothing wrong with getting up-to-date DOPS towards the end of your training block, just to show that you're, you know, still able to do it. You don't just have to have one signed off and then that be it, sort of thing. But I would, you know, I think it's right that it is part of your evidence, because you have worked and you've got that as part of your training. We just need to see that there's ongoing sort of acquisition of skills and engagement with ePortfolio. I think that's probably the way we would view that. Hopefully that answered that question. So I've started training ST3 in March. I'm trying to fast track to ST4. I've been signed off on my competencies with the, so does this count? So signed off on competencies with the certificate of completion of core competencies. So is that something that's been signed recently, or? I probably need a bit more information about that.
Yeah, so that was hi, I'm Kenny.
Hello.
Hiya. So the form was required for our application, for the application. So we had to like have the particular form, that's a completion of core competencies, like level 1 training.
Yeah.
So that was signed off, and that was what we used to, that was part of the document we submitted for the application to get into ST3.
Okay. Okay, so I'll take this back to Dr. Wynne just to make sure what I'm telling you isn't inaccurate. But I think what I would say here is we're just going to need to have, and it's going to be tricky because you've only just started in March. But if you're wanting to fast track, I mean, it's easy because you're on the Progress Plus. So actually, from that particular, because you're gone to the new curriculum, you don't actually have to have anything signed off until the end of ST4 to progress. So I think that there'll be a lot of things that you should be able to evidence during your next year, even if you are fast tracking and missing, half of ST3.
Sorry.
No, don't worry. Sorry, I'm just going to start my coughing now. This is my pertussis, remember. So I think it's just about continuing to demonstrate and making sure that your supervisor acknowledges that actually you have got those competencies, I think would be the thing.
Okay.
That would be my suggestion. And then because you're going to have to try and link them to some of your to be able to sign off your curriculum at the end of ST4. Hopefully that helps. But I'm happy to look
thank you
through it
very
separately.
Yeah, thank you.
That's all right. For the trainees on the old Progress, can we link the same supervised learning event or work-based assessment to the corresponding domain key as well as the subspecialty? You can. I mean, there's a limit to how much. What we don't want you to do is just link. I don't think if you over tag something, and one CBD is suddenly, linked for absolutely everything, it will start to flag. But yeah, there are times where they will, the domains for your subspecialty and the domains for your generic, your sort of will merge. So I don't have too much concern about a bit of cross-linking, but just try and make sure that you're not trying to stretch that one thing across too many domains. And I don't know, they used to limit you on how many you can actually link it to. So I would just be mindful of that as well. But in all honesty, we are relying on your supervisors to look at your linking in more detail. We do not have time to go through everyone's curriculum, but we will look and see what's being linked, and we will randomly pick one and just try and make sure that we feel it's, as much as we can do to try and make sure that you are sort of on track. But that's why I go back to, it's that supervisor's report that really is the most important thing, and it's what you contribute and then what they write that really helps us, particularly around the curriculum. What's the minimum SLEs do we need for each? So there isn't a minimum at all. Quality, not quantity, really. Depends. Some people are fantastic at linking, and there's like 50, 60 for each one, and it's quite overwhelming. It's really good to get into the habit of using your ePortfolio. I know everyone gets very frustrated, but when you become a consultant, you're going to have to still evidence, and actually it's the way that that medicine is and where all specialties are going. So if you can develop good habits now, I would highly recommend it, because I was terrible and still have to be prompted quite a lot. There are no minimum ones for logging, because there are some that are really generic and it's just like, one thing, signing it off, whereas others, it's nice to see a few examples. But again, it's just about looking and one in each key capability is going to raise an eyebrow. So just try and get into the habit, because there's so many things you can link that you wouldn't even think about. And my biggest trick is just have a little read of the Progress Plus or Progress curriculum and the ideas they have for the learning outcomes, because I think you'll be surprised at some of the things that you could use that you wouldn't even think of. So just it's worthwhile from that point of view. In terms of how many work-based place assessments, there are guidelines on the Royal College website, which does give a rough idea of the kind of things that we expect, and we would expect an MSF sort of every year. I think it's a really nice way of getting some feedback. There are certain numbers of things, we used to specify you had to have so many KEXs, so many CBDs. Now we're not quite so restrictive within the college, but I think it's really important to have a range of them. And I try to sort of suggest to my trainees that we do have, you know, a good number, but you do have to have things like a safeguarding CBD. When you get through training, you need to have docs. You can utilise things like the leaders and the ACATs and the hats and everything else. It's all evidence that you can use and link through your e-portfolio, which shows your progression. So try and keep an eye, because they will keep on changing in terms of what assessments you absolutely categorically have to have. And there are times where we've had to write to someone and go, you're 2 docs short, hurry up and get them, and then we can give you your CCT. So just keep a little bit of a track on that. I hope that answered that question. I'm ST3 on general peds, at a different CS to ES for the previous 6 months. CS was in general peds. ES did the end of placement report. Yes, so where you had a different CS to your ES, your CS in general peds will have to write your CS report, because I imagine that the ES didn't tick that I am also the clinical supervisor. So what I would expect for you is that you will have an ES report for ARCP and a clinical supervisor's report for ARCP for your community, and then you'll have a joint one for your next 6 months. Hopefully that helps. And I'm ST3, just joined, so your ARCP will be, so we're going to do an ARCP in the winter to sign you off. And so you'd be going to ST4. I'm going to have to think about this one. Okay. So you're wanting to apply for grid. You've got certainly got time. In terms of, it's all about you. So you're at, depending on what grid you're applying for, obviously it's about being able to have enough time to evidence and for your application. But I can't imagine, because you would apply for grid this October, so you would start it, and then by then you will be, so you'd be halfway through ST4. They may ask you to defer start until to start it, sorry, not start, that leads into confusion, until the March time, but it's probably worth contacting the CSAC of the specialty you're interested in and finding out what they feel. I think that's probably the best way from that point of view. Okay, at the moment there are no new questions in the chat. I'm just going to quickly look at the so we talked about how to make, not sure how to tell if I'm ready for ARCP, how to make my portfolio easy. I mean, basically, it's just about trying to make somewhere that we can see where all the relevant information is. But I think the best way to know if you're ready and to show us is through your report. So don't rush it. Make sure that you really sell everything that you've done. Does everyone understand because you're going to probably have to advise your supervisors about how to sign off on the curriculum? Is that something that people are happy to advise their supervisors on?
No.
Right, okay. Let me see if I can just log in to Kaizen. So my trainee has given me permission to share his e-portfolio before everyone panics. Let me just see if I can get him up, and then we will see. So 2 seconds. So it used to be, let me just share, hang on. Okay. So Zander very kindly has allowed me to utilise his e-portfolio. It used to be really easy, because can everyone see that? I hope you can. But you used to basically have on the summary page, there used to be a thing that said curriculums right in the middle, and you could see where it was all logged in. But basically what your supervisor has to do is, there is a curriculum linked somewhere, and everyone's e-portfolio changes, so it's quite frustrating. But the best place that you can find it is if you go to the timeline and you go to curricular objectives. Okay, And this is Xander's old one, so you can see it's clicked as partially achieved or achieved already, okay? And we've got different learning objectives, but basically what can happen is if I click on teamworking where it's partially achieved, all I have to do, as I'm the only person that can do it is the supervisor, is click change, and then I can decide what I want to say, okay? And then I press record or whatever. And essentially what then happens is that you will see that it will come up here as saying achieved. And what you're needing to see, and again, it can be ticked off at any point in time, but it needs to be done for those core progression points. Does that make sense? Hopefully I've stunned you into silence.
Yeah, no, I think it does. It does make sense. I think some of us who are like ST4s, some people may have had that before. I think some challenges we've had is some of them didn't pull through to the new Progress Plus. So I think it's all up, probably maybe if we need to sort of go back and get them all to pull through again.
So if you have any problems with things that you don't think have pulled through, you email training services, okay? And training services can look through and try and do it. We've definitely had it with people who are CCTing and then they were put on the Progress Plus and then put back and things like that. And, you know, I think we understand there's going to be a little bit of teething where people have gone from one to the other and where you had everything signed off and then suddenly it's sort of disappeared. But I think it's worthwhile having a little look at what you think is missing, speaking to training services. And again, if you explain it in your blurb, what you write, we can then understand what's going on. Okay. So the key progression points, depending on whether you are in Progress or Progress Plus. So as I say, most people will be Progress Plus. And so your key progression points is between level 1 and level 2, which is end of ST4. And then CCT, which is obviously the end of ST7. The key progression points for Progress, which really it should only be level 3 trainees, would now be you moving through and doing 6, 7 and 8, and it would be your CCT. So hopefully that answers that. Does it need to be done at career progression point or for every training year? You don't need to sign off. Your curriculum is for that level of training, okay? So it's expecting you that in the 4 years, you're going to be able to achieve all the different learning outcomes. And so no one is expecting you to whiz through it. Obviously, if you're somebody who's hoping to fast track, then you'll need to do it a bit quicker. But essentially, we'll be looking that there is linking for the curriculum, but we won't be expecting it to be signed off unless you are at the end of, you know, you're at that point where you're going from ST4 to ST5 on Progress Plus or ST7 CCT, okay? So the end of ST7, a key progression, it will depend on whether you are on Progress or Progress Plus. Is that clear? Hopefully. So on Progress, no, it would be ST8 would be the end of your progression, because if you're still on Progress, you've got ST8 still to go to achieve the rest of those learning outcomes. But if nothing is linked at all, we would be a bit concerned. But obviously, it really will depend on time out of training, other circumstances and things like that.
All right.
Anything else at all?
Thank you very much. I'm just looking through the things people sent in just to see, like just on the from the survey we did. I think we sort of touched majority of them, to be honest. We've talked about tagging. We've talked about if you did some things pre-training, you can definitely add it on. We've talked about the key capabilities rested to what changes. Okay, I think someone asked, so we talked about the ARCP dates. I think another question person put was for ARCP for grid trainees, to try to arrange CSAC review meeting prior to ARCP in a timely manner. Would it still be on the same date for them?
Yeah. So we do grids at the same time as everyone else. So we really need that CSAC progression form before then. And again, as I said, I know you'll get something that will say make sure everything's in before the end of May, but hand on heart, I'm not going to be looking until the 19th. So you do have a little bit of flexibility, but it is about planning. Okay, it's about contacting your supervisors and your CSACs now and arranging that meeting, because you can imagine the CSACs are going to have all the trainees to try and fit in. So if you can be sort of proactive and time and efficient, then we might, you hopefully will get things done. And there are times where it's out of your hands, your CSAC person or your supervisor might be unwell, and we do understand that. So, there are times where we might say, okay, we'll hold fire and we won't do your ARCP until August to give it time. So if we're aware of the situation, we will be very adaptable. And I promise you, we are not ogres. We're all out to try and make everyone's life as simple as possible, because we don't want to have to redo them if we can possibly help it. There was just something Kiara said, as ST4 on Progress Plus is level 1 learning outcome that needs to be completed, achieved, or level 2. If you're on Progress Plus, there's only 2 levels. So it's core, which was the level 1, I think, and then post-core or specialty. Well, I can't remember what it's called now. That's terrible, isn't it? So that's basically the 2 that you would have. And I think I'm ST8, but grid and CCT has not been confirmed. So the difficulty, if you are grid, I really think there's a battle between CSACs and us, not a battle, but we will be informed by CSAC as to how much time they think you need. So it's really important you have the conversation with CSAC. We can't say, most grid trainees, they have and different grid specialties will have a different sort of stance on whether you have to absolutely do whole time equivalents or not. So we will only go on what the CSAC tell us. So we can certainly talk, but we will not decide your CCT. It's down to CSAC, because they're the ones that sign off your specialty training, and we're effectively just ticking the box. And that's what we've fed back to the CSACs, because we need them to be really clear about what they feel a trainee needs or doesn't need. And we're happy to have the communication, but we will have to go on what we think, and it may not be right, especially if it's a subspecialty that is very much based on exact times. So from that point of view, I hope that
that question was from me, Danica, community grid. So I've been going round and round in circles about my CCT date from community chair of CSAC, and they're now on leave until the end of June, so I'm not going to get anywhere further with them. So yeah, it's just that having a conversation before something's put on paper, so that I'm clear about what the decision is, I suppose, more than anything else, but in case I have more information than the person that's in the room.
Yeah, so we won't be able to make that decision though, because it's really, because CSACs are the ones that decide if you've done enough. So probably what will happen if the CSAC is not around until the end of June, then I would suggest we defer your ARCP. I mean, you can certainly look at what you think your CCT date should be. Yeah. Because that usually what you've worked, but it is really difficult. And as I say, there are certain subspecialties that are really pedantic about time. So it's absolutely, we're not going to put anything down in writing without having clarification. And if we're not sure, then we're going to need to, we would probably defer it anyway, Danica, but we can certainly, I've written a little note. I'll talk to Dr. Wynne about it and we can try and come up with a plan.
Lovely, thank you. And I'll have my CSAC progression form with Paul, but again, he's saying different things to the overall chair as well. So it's just very, very confusing,
really frustrating
and unhelpful.
Yeah,
I need to apply for jobs too.
Yeah, no, exactly. Well, Paul should hopefully be able to advise a little bit.
Yeah.
So I suggest we
Yeah.
outside of this, we can try and make
Yeah.
sure that before we do it, we know what's going on.
That'd be really helpful. Thank you, Ellie.
Okay, no worries. Anything else at all for everyone? Anyone even? So I am really happy to be contacted if you've got any queries. From my perspective, as I say, we one more. I had an UP last year, then started ST4 as part of Progress Plus. Khaled, I'm going to have a think about how we answer that, because so if you've had an UP, so you'd okay, so you were. I think we'll have to have I'll have to have a talk with Dr. Wynne about how we manage something like that, where you've had, you've done everything and it's now you're back to ST4. And I can't imagine that we'd have to ask you to relink it, but I think we're going to have a bit of a think about how we do that, and there may be some guidance. So I'll email you separately about that. No problem at all. Okay, right. I hope that has been helpful. Really happy to be contacted should there be any more questions. Yeah, good luck and don't be scared. It really isn't it's not a sort of scary process. It's just all just trying to tick the boxes, but also try and get to know you through your e-portfolio a little bit, because we can't get to meet all of you at once. But yeah, you'll be absolutely fine, I'm sure.
Thank you so much for your time, Dr. Day. We really, really appreciate this. And thank you so much, everyone, for joining in. So I think we finished sort of right on time, just a few minutes late. So yeah, very well done. Thank you. And yeah, if anyone has any more questions, like Dr. Day says, feel free to email her directly, or you could channel your questions to the training committee as well. We could always pass it on to Dr. Day and then get feedback on it. So, but yeah, very well done. Thank you.
All right.
Yeah, we'll be sending out a feedback form, and after which you get like your automated certificates for attendance. So keep an eye out for that. So hopefully I'll try and do that at some point during the night shift. So yeah, thank you very much.
Have a good night shift. I hope it's not too busy.
Hopefully not.
Thank you, Dr. Wynne, for also joining. And thank you, Dr. Lola.
Oh yeah.
And thank you, Dr. Day. All I can say is I'm glad we didn't have this session during the conference. Thank you so very much.
Pleasure. It's a
pleasure. Have a good night, everyone.
All right,
Bye.
Good night. Take care, everyone.
Thank
Bye-bye.
you. Bye.
Mm-hmm.